How sleep apnea affects the brain and how the brain heals, exploring the neural, structural, and cognitive effects of obstructive sleep apnea by Antoine Gosselin. In obstructive sleep apnea, throat muscles relax during sleep, making the airway narrow or close, reducing airflow and lowering blood oxygen levels. The brain senses this and briefly wakes you to reopen the airway, often without you noticing. These episodes can occur dozens of times per hour and prevent deep restorative sleep. OSA affects 1 in 5 adults. Recent findings show that obstructive sleep apnea reduces cognitive performance, but they also show that this function can be recovered with proper treatment. It is often linked to snoring and cardiovascular disease, but it also has been proven that it alters brain structure, impairs memory, affects mood, and raises dementia risk. However, when oxygenation and sleep continuity are restored, the brain shows remarkable recovery. Each apnea episode triggers intermittent hypoxia, cycles of oxygen deprivation and reoxygenation. These cycles cause localized neural damage similar to ischemia reperfusion injury, what happens during a stroke. Also, OSA induce sleep fragmentation due to the micro-awakenings and keep the brain in chronic sympathetic overdrive, elevating stress hormones and disrupting homeostatic processes like memory consolidation. Patients with OSA show reduced activity in the frontal gyrus and posterior cerebellar lobe, areas involved in executive control, attention, and coordination. OSA also damages the superior longitudinal fasciculus, a white matter tract critical for memory integration and emotional regulation. Cortical thickness in the temporal pole is also reduced, affecting semantic memory. It also paradoxically enlarges the hippocampus, likely due to the inflammation or compensatory swelling. These findings show that OSA is not merely a functional sleep disorder, but a structural brain condition with important psychological consequences. As a result, individuals with sleep apnea often experience anxiety, depression, and other mood disturbances. OSA's effects are especially pronounced during REM sleep because the airway is more prone to collapse due to the lower muscle tonus of the genioglossus muscle. Severe oxygen drops during this stage correlate with worse verbal memory, particularly in older adults at risk for Alzheimer's disease. Because REM sleep supports hippocampal replay, its disruption may impair neuroplasticity and promote beta amyloid and tau accumulation, accelerating neurodegeneration. Nonetheless, this change can be reversed. The default mode network, DMN, is an important circuit for memory and self-referential thought, and it has been shown that continuous positive airway pressure, CPAP, therapy can increase cortical thickness and restore functional connectivity within the DMN. After 3 to 6 months of consistent CPAP use, studies reported better episodic and working memory, sustained attention, and executive control, particularly in patients using the device at least 4 hours per night on most nights. People that used it for over 6 hours achieved near normalization of memory. This means that the improvements extend beyond reduced sleepiness to genuine cognitive recovery. In summary, OSA disrupts brain function in many ways and at many levels. Fortunately, these effects are not permanent. Consistent CPAP therapy can restore healthy sleep patterns, reverse cortical thinning, and reactivate brain networks. Knowing that, treating sleep apnea isn't just about breathing better at night, it's about protecting and healing the brain, giving the mind another chance to repair, reorganize, and remember.